Hi everybody, welcome back to UWorld Nursing's Next Gen NCLEX review session. My name is Jackie and I'm a nurse here at UWorld. We're so glad to have you guys with us today. We are doing one of our most requested question drill sets. We are covering ECGs. So we have 8 practice questions that we're going to go through. One note when you see these ECG strips, these are 10-second strips. So a lot of times you're going to see 6-second strips when you're getting ready for your NCLEX, but what we have today are 10-second strips. We'll give you hints along the way if you need to count beats or anything like that, but just a heads up before we get started. But we are in the home stretch of Nurses Week. Happy Nurses Week to everyone. We have another giveaway that we're going to be doing on this live, so stay tuned. We're going to give you a little bit more information on that, how to be eligible for one of our 2 big giveaways today. So we're glad to have y'all here. Be sure and follow us on your favorite channel, and let's get started. And I should say we have Nurse Samantha moderating the chat, so feel free to ask any questions. All right, question 1. The nurse is caring for a client who is experiencing the cardiac rhythm in the ECG strip shown below. The nurse should recognize that the client is experiencing option 1, atrial fibrillation, option 2, ventricular fibrillation, option 3, ventricular tachycardia, option 4, sinus bradycardia. All right, drop those answers in the chat. Let us know what you think. I'm going to enter into the chat myself. And again, stay tuned. We have 2 giveaways that we're going to be doing over the course of our live today. So be sure and stay tuned. We're going to give you all the information after this question. All right, let's see what you guys are thinking. All right, good work, you guys. All right. Our internet's coming. I'm getting there. I can almost see it. All right, well, good job, you guys. I'm seeing a bunch of correct answers, so you guys got it. What we're seeing here is AFib, so let's kind of walk through what we see with AFib. So we're going to see that irregular rhythm. So the space between our QRS complexes is going to be different every time, kind of those essential elements of what we see in normal sinus rhythm, a P wave for every QRS, the correct spacing, it's going to be off. So we're going to be seeing a lot of fibrillation or kind of like glitching of our atrium. So that's those fibrillatory P waves, what we see in between those big kind of peaked QRS complexes. So essentially what's happening is we're having some like miscommunication, some misfiring happening in our atrium, and that's going to get the rest of our kind of cardiac rhythm off. So what we worry about for our clients that have AFib is this swirling of blood in our atrium. They're going to be at an increased risk for clot formation, for thrombus, and we know if that thrombus goes on the move or embolizes, where our clients are going to be at risk for a stroke. So we definitely want to be sure that we are monitoring these clients that have AFib, that they're on lifelong anticoagulation, and that we're making sure that we're doing everything to keep them safe in the long run. But again, we see those fibrillatory P waves. We're not having succinct messaging, communication from our atrium down to our ventricles. We're not squeezing or fully contracting the atrium. So we're going to have this kind of slow swirl, kind of pool of blood in our atrium. That's what's going to increase our risk for that thrombus formation. So good work on that one, guys. You did great on that one. Okay, time for the big reveal. We are going to be giving away today on our live 2 30-day UWorld Nursing subscriptions. So to be eligible or to enter into this giveaway, go to uworldnursing.com, hit that yellow subscribe button. You're going to see it right at the top. If you're on a desktop, it's going to be a little off to the left. If you're on your phone, it's going to be right there on that home screen. So again, go to uworldnursing.com, hit that yellow subscribe button. Then you're going to be taken to a screen. You're going to put in your name, your information, your email, graduation information, and hit subscribe. That's going to subscribe you to our event calendar, but that's also going to be your entry into the giveaway. So over the course of the live today, be sure and do that at some point. Again, go to uworldnursing.com, hit that yellow subscribe button, and subscribe to our event calendar. And then at the end of the live, we will reveal the 2 winners of the 30-day UWorld Nursing subscription. All right, good work, you guys. Question 2. The nurse is caring for a client who is short of breath and is experiencing the cardiac rhythm in the ECG strip shown below. Which of the following actions should the nurse take? Option 1, administer an IV fluid bolus. Option 2, prepare the client for synchronized cardioversion. Option 3, instruct the client to bear down. Option 4, prepare to administer IV push atropine. Again, if you guys are just joining, we're glad to have you all here today. We're covering ECGs. We just announced that we're going to be giving away 2 30-day subscriptions. Be sure and check in with us and hit that subscribe button at uworldnursing.com and follow us too on your channel. We'll definitely be looking and noticing if you guys are following. That'll definitely help your chances. So be sure and follow us on your favorite social channel. And if you're on TikTok, share this session. The more the merrier. This is one of our most requested topics. We definitely want to have as many of you guys on. You're the whole reason we do this. So we definitely invite you guys to be here today. Let your friends know we're covering ECGs. I know this was like one of the hardest things for me in nursing school, and now being able to teach you guys about it, definitely have a much better understanding. So definitely want to help you guys as much as we can. All right, and thanks Maddie Ball for subscribing. We appreciate it. Good job. And Sam's for sharing the live. Good work, you guys. And good answers coming through too. All right, good work, you guys. Again, share this live, follow us on your favorite channel, and then over the course of the live, we'll be giving away 2 free 30-day subscriptions to UWorld Nursing. So perfect time for all of those who are graduating, getting ready to take your NCLEX. All right, so you guys did great on that one. The correct answer is going to be option 4, prepare to administer IV push atropine. So what we see on this strip here is bradycardia. So we have a heart rate that is less than 60. So we can see on here, again, these are 10-second strips. So we have a beat of 1, 2, 3, 4, 5, 6, 7, 8, 9. So we have 9 QRS complexes. So that's going to indicate our beats per minute. We're going to take that number times 6 because, again, this is a 10-second strip. We have 60 seconds in a minute, so we're going to find the right number to multiply to get our beats per minute. So we have 54 beats per minute, so we have sinus bradycardia. So when we treat sinus bradycardia, we are going to be doing a couple of things. So first, we are going to make sure our client is symptomatic. From there, we're going to give some medications. So atropine is going to be one of those medications that we can use to treat bradycardia. One of our viewers on a previous live we did had a great way to remember it. The word pine is in atropine, so like a pine tree that's pointing up. So it's going to increase your heart rate. So atropine is one of those medications that we're going to give. After that, we would maybe do something like an external pacemaker. And then the ultimate fix for bradycardia is going to be an internal pacemaker if it's not corrected by medication. So definitely our correct answer on this one is going to be option 4, that atropine is going to increase our heart rate. What we see in option 1, administer an IV fluid bolus, that's not anything that we're going to be doing for bradycardia. Maybe we would do that for tachycardia if we need to increase our circulating fluid volume to help lower our heart rate. Synchronized cardioversion is not going to be something we're going to do for this client. That would be something we would do for other dysrhythmias, but definitely not for bradycardia. And then instructing the client to bear down, that would be something we would do for SVT or supraventricular tachycardia. So our correct answer on this one is going to be administer IV push atropine. Again, that's a medication that's going to increase our heart rate. It's going to help our heart rate increase. Again, when we have bradycardia, we have a delayed signal happening in our atrium with our SA nodes. So as those signals travel through our heart, we're having a delayed kind of start of our cardiac cycle. So that medicine is going to help with that signal. All right, good work, you guys. Question 3, the nurse is caring for a client who's experiencing the cardiac rhythm in the ECG strip shown below. The nurse should recognize that the client is experiencing option 1, ventricular tachycardia, option 2, atrial fibrillation, option 3, ventricular fibrillation, option 4, sinus bradycardia. All right, good job, you guys. Let's see what you think. Good answers coming through. I'm seeing a lot of option ones. You guys are doing great. And again, just a reminder, we're giving away 2 30-day subscriptions to UWorld Nursing today. To enter, go to uworldnursing.com, hit that yellow subscribe button, enter your information, and then we will pull 2 winners and announce them at the end of the live today. So you have all of the whole live to enter to go check it out. And when you hit that subscribe button, it's going to subscribe you to our event calendar. So you'll be able to see all of the lives, the times, the topics, all that good stuff that we'll be covering a few weeks in advance. Good work, you guys. A lot of option ones coming through. Well done, well done. You guys got it. So our correct answer on this one is going to be VTAC, which was option 1. So what we're seeing here is just ventricular activity. So the name kind of explains this. We just have a very overactive ventricle. So that ventricular activity is overtaking the activity of the atrium. So it's kind of the QRS complex, which is what we see, is really swallowing up that activity of the atrium. When we think about our heart, and you kind of think about how blood is moving through our heart, we have our blood starting in our atrium going down to our ventricles. Our atrium are much smaller than our ventricles. Our ventricles are what squeeze that blood out either to be reperfused or to be in our lungs or to go out through our whole body. So it has to, those ventricles have to be much stronger and much bigger. So there's more electricity required to squeeze them. So that's exactly what's happening. That's why you see those QRS complexes showing so much larger than the P waves or the PR interval on these ECGs. So with VTAC, when we have more than 3 PVCs in a row, that's really what VTAC is going to be. So we have a speed problem with our ventricles. So essentially what we said, that ventricle is going to kind of take over as the pacemaker for our heart. So it's going to look like tachycardia. We're going to have a heart rate of greater than 100 beats per minute. But again, we're only seeing that ventricular activity, those QRS waves. So again, our P wave is going to be invisible, and those QRS waves are going to be a little wider than they should be and a little bit distorted. But again, we know VTAC, we need to be able to identify VTAC. VTAC can lead to VFib, and we know we need to defib VFib. VFib is a life-threatening dysrhythmia, so we need to intervene on VTAC before it progresses to VFib. So good work on that one, guys. All right. Again, another reminder to enter into our giveaway today. We're giving away 2 30-day UWorld Nursing subscriptions on our live. So to be entered into that giveaway, go to uworldnursing.com, hit that yellow subscribe button, enter your information, and hit subscribe. That'll subscribe you to our event calendar, which is also your entry into the giveaway. So be sure and do that. All right, moving right along, halfway marker, question 4. The nurse is caring for a client who's experiencing the cardiac rhythm in the ECG strip shown below. The nurse should recognize that the client is experiencing option 1, ventricular tachycardia, option 2, ventricular fibrillation, option 3, sinus bradycardia, option 4, atrial fibrillation. All right, let us know what you think. Good work, you guys. Let's see those answers. And again, we hope you guys will share this live. The more the merrier. We do all of this, and we started all of this for you guys. We want to be able to provide you with great content that you can take in on social media, that you can tell your friends about. We want to welcome everyone into the UWorld Nursing community. We've had a lot of fun this week on Nurses Week doing kind of our most requested lives, our most requested topics, and really spending time on some of those heavy-hitting topics for you guys. So between myself and Nurse Samantha and Nurse Andrew, who's been covering in the evenings, it's been a lot of fun for us. All right, good job, you guys. Well done. I'm seeing a lot of option 2s, so you guys definitely have it. Good work, you guys. Well done. All right. Sammy asked how many questions are we doing today? We are doing 8, so we are in the home stretch. And again, we have these available, or we will have this available on demand when we're done, so you can always come back and practice. Good work, you guys. Okay, you guys got it. The correct answer was option 2, ventricular fibrillation. So when we have VFib, our ventriculars, our ventricles are quivering. They're completely disorganized, and I feel like that's what you see on that strip. It's kind of the unraveling of our cardiac function, of that electrical system, that electrical current that's running through our heart. So whenever we have that quivering ventricle, we're not going to have sustainable cardiac output. So we're not getting like a cohesive squeeze of that ventricle. We're getting just little like glitches here and there. And we know that we need that squeeze to get all the way to the most distal parts of our heart. So we're going to worry about decreased cardiac output and perfusion to our vital organs. And again, we defib VFib. This is something that is life-threatening. So again, when we look at the strip, we're going to see just like pretty much chaos. So we can't really measure much of anything. We don't have visible P waves. We have no QRS intervals. It's just kind of the unraveling again of our heart function. So what we do in the case of VFib, if they're pulseless, which, you know, pulseless VFib they are, we are going to do CPR. So of course we're going to start CPR, start those compressions. We're going to want to defibrillate so we can see if we can reset that electricity in the heart. And we're going to give medications like epi and amiodarone, those antidysrhythmics, to help with our heart. And then of course we're going to give oxygen and support an advanced airway if they need it. So again, VFib, this is we defib VFib, they're pulseless. We're going to do CPR, give medications, and hopefully get that heart restarted. All right, question 5. The nurse is caring for a client who's experiencing the cardiac rhythm in the ECG strip shown below. The nurse should recognize that the client is experiencing option 1, atrial fibrillation, option 2, sinus bradycardia, option 3, ventricular fibrillation, option 4, ventricular tachycardia. All right, let us know what you guys think. Good work, good work. Nice job, you guys. And let us know too, I think maybe we had a NCLEX passer, but let us know when you guys are getting ready to take your NCLEX. If you've taken it and you've passed it, we want to celebrate you guys. We want to wish you good luck, all that good stuff. So let us know where you are in your nursing school journey. We know a lot of you guys are probably maybe like in the thick of getting ready for finals. So be sure and let us know where you are so we can wish you good luck, recommend any of our live lectures or questions for you. So best of luck to y'all, and a lot of good answers coming through. And thanks to Jessica for sharing our live. We appreciate it. Good luck to McKenna. You're taking your NCLEX in September. That's exciting. Thank you, Malika, for subscribing. Oh, congratulations to Yili, who took yours yesterday. That's exciting. Good work, you guys. Oh, that's awesome. Well, best of luck to all of our test takers and everyone getting ready to kind of really dig into your study journey. All right, so you guys got it. What we see here is sinus bradycardia. So sinus bradycardia, which was option 2. So sinus bradycardia is essentially, sinus means we have all the essential elements of like normal heart function, but bradycardia means that our speed is low. So we're going to have less than 60 beats per minute on here. So what we see on this is 54, would be 54. So again, a reminder, we have 10-second strips that we're showing today. So if you count those QRS complexes and then multiply it by 6, that's going to give you your beats per minute. So 10 seconds times 6 of those strips would be 60 seconds worth of strips. So we have 54 beats per minute. So again, what we have when we have bradycardia, we're going to have kind of a problem with our SA node. It's not going to be firing as quickly and efficiently as it should be. So for us to kind of intervene on bradycardia, if our client's symptomatic, you know, some people are going to have highly efficient hearts, like some of those really good endurance athletes. Their resting heart rate is going to be maybe in like the high 40s, low 50s, and for them that's normal. But when we have someone that's symptomatic, we'll intervene with medications like atropine to increase our heart rate. We can do an external pacemaker, which essentially kind of takes over the pacing of our heart but externally. And then the ultimate fix for sinus bradycardia is an internal pacemaker. So essentially kind of providing that stimulus, that electrical current to kind of take over the malfunction of what's going on in our hearts. So again, we'll give atropine, external pacemaker, and internal pacemaker is the ultimate fix. I should also say sometimes bradycardia is caused by medications. So a lot of times we maybe have to hold a medication. So think about like a beta blocker or anything that's a heart rate lowering medication. If that's the cause for bradycardia, then obviously we'll hold that if that's our kind of initial cause, and then we'll escalate to things like giving atropine. All right, good work, you guys. Another reminder, we're giving away 2 30-day subscriptions to UWorld Nursing. To be entered in, go to uworldnursing.com, hit that yellow subscribe button, enter your information, and then we'll announce 2 winners at the end of our live today. So stay tuned to see if you're the big winner. All right, moving right along, question 6. The nurse is caring for a client who's experiencing the cardiac rhythm in the ECG strip shown below. Which of the following medications should the nurse expect to be prescribed for the client? Option 1, epinephrine. Option 2, atropine. Option 3, rivaroxaban. Option 4, lisinopril. Good work, you guys. I see Dallas Lee, if you subscribed this morning, you can still enter again. So head over to uworldnursing.com, put your information in again, and you have another chance to win. Good work, you guys. Well done, well done. I'm seeing a lot of great answers. I kind of gave you, if you guys were on at the start of this live, I kind of gave you a little bit of a hint of what this dysrhythmia can cause and what type of lifelong medication these clients need to go. I think Stephanie is asking where to go. Go to uworldnursing.com and you'll see a yellow subscribe button. If it's on your phone, you'll see it right on that home screen. If you're on a desktop, it'll be a little bit over to the left. So good work, you guys. Great answers. Good work, good work. Awesome. All right, so you guys got it. Our correct answer on this one is going to be option 3, rivaroxaban. So again, the dysrhythmia that we're seeing here is AFib. So we know when we have AFib, we have that kind of slow swirling and pooling of blood in our atrium. One thing about our atrium too is we have a little appendage that's kind of like, if you think of your atrium as like a pool, the little appendage is like the connected spa. And so blood is kind of swirling in there, but it has a high propensity to form a thrombus. And so that thrombus, if it were to dislodge or go, from being stationary to mobile or embolize, the first place it's going to go is likely to our brain. So we have a high risk of stroke when we have AFib. So these clients need to be on lifelong anticoagulation, and rivaroxaban is that medication. So it's an anticoagulant. It's going to help make our blood a little bit thinner, decrease that risk for clot formation, and make sure that we lower that risk for stroke as much as we can. The other options, what we see, those are not really going to be what we're expecting in this situation. Again, we are looking for anticoagulation when we have AFib. Good work, you guys. All right, question 7. The nurse is caring for a client who's experiencing the cardiac rhythm in the ECG strip shown below. The nurse should recognize that the client is experiencing option 1, atrial flutter, option 2, atrial fibrillation, option 3, premature atrial contractions, option 4, premature ventricular contractions. All right, let us know what you think. We also have if ECG strips are really tricky for you, which they should be tricky for everyone. They're not a super straightforward thing all the time. We do a great lecture on ECG strips, and we break down all of the ECG strips or dysrhythmias that are mentioned in the test plan. So you guys probably know about the test plan, but essentially it's a blueprint for your NCLEX, and we really break down the ones that they call out. So there's a lot of dysrhythmias that can happen, but some are brought to the attention for the test taker to know. So we walk through what a normal strip looks like, and then based on that kind of foundational knowledge, we talk about where the dysfunction is happening in our heart and what that translates to on the kind of electrical presentation of everything. So again, these ECG strips, they're just a visual representation of the electricity and the conduction that's happening in our heart. So when you kind of think about it that way and understand what's happening in our atrium versus our ventricles and where that malfunction is happening, it's a little bit easier maybe to break down. So you can check that out. It's easy to find on YouTube. All right, you guys got it. Our correct answer on this one is PVCs. So that was option 4. So when we see PVCs, one PVC is okay. If anytime we kind of mess with the heart, if we do any type of procedure or agitate the heart in any way, we would expect to see a PVC. But when we have multiple PVCs, we worry about that progression to VTAC. We know VTAC can lead to VFib. VFib we know is a lethal dysrhythmia that we need to defibrillate. So again, we're going to see when we have those PVCs, we're going to see variable heart rate. So you're going to kind of see those, the rhythm is a little bit irregular. We're also going to see kind of some distortion with our QRS complex, which again is that visual representation of the ventricular contraction in our heart. So again, we're going to have that irregular rhythm, which is essentially just that transition from atrial activity on the ECG to ventricular electrical activity on the ECG. It's not going to be smooth. We're also going to see a regular rhythm. It's going to hide our P wave, so kind of hide that atrial activity in the QRS. So it's going to look out of sync and kind of like a jolt almost. So again, one PVC is not anything to worry about, but when we have 3 or more, that's considered VTAC. We know VTAC can cascade into VFib, and VFib is lethal. So definitely something to keep an eye out for, but you guys did great on that one. Well done, well done. Congratulations to Nurse Destiny, who used UWorld to pass your NCLEX. Thanks for stopping in to let us know. Good job, you guys. All right, last reminder, we're giving away 2 30-day subscriptions to UWorld Nursing. Go to uworldnursing.com, hit the yellow subscribe button, subscribe to our event calendar by entering your name and email and graduation date. We will announce the winners shortly at the end of our questions, and we will contact you with how to redeem your 30-day subscriptions. All right, last question. You guys did great. The nurse is caring for a hemodynamically stable client who is experiencing the cardiac rhythm in the ECG strip shown below. Which of the following actions should the nurse take? Option 1, prepare to administer amiodarone. Option 2, prepare the client for immediate defibrillation. Option 3, continue to monitor the client. Option 4, request a prescription for digoxin. All right, good work, you guys. Good job, good job. Well done. Has anybody redeemed any good like Nurses Week discounts or anything like that? I know when I was one of my first years as a nurse, I got free Chipotle one year, and that was exciting. Awesome work, you guys. Good job. And again, when we're oh, someone had free Sunnies. That's cool. It's a good time too. I think sometimes when you buy like certain shoes or you buy like certain scrubs, sometimes they have discounts this week too, so you can stock up on things you might need. Awesome work. Good job, you guys. Good work. All right, you guys got it. And let us know too how you do out of 8. And then after we explain this question, we'll announce the winners of the 2 30-day subscriptions. Okay, so what we have here, our correct answer on this one is going to be amiodarone. So what we see here is VTAC, and we see in the question, it says that the client is hemodynamically stable. So we are going to treat this client with medication or cardioversion. So amiodarone is a dysrhythmic, anti-arrhythmic medication. We're going to give it as an IV bolus, and then we're going to titrate it to a drip. We know, again, VTAC can lead to VFib, which is fatal, so we need to monitor, we need to intervene, we need to get them out of this dysrhythmia. What we see in option 2, we're not going to defibrillate this client. We would do cardioversion. So again, you'll probably remember hearing from, we did this lecture recently, when we cardiovert, we want to hit that sync button on the defibrillator, but we're going to have the machine sync up with their heart. It's going to initiate that shock in a very specific way at a very specific time. And so definitely different than a defibrillator. Option 3, we're not going to just monitor this client. Again, this is VTAC, we know leads to VFib. We need to stop this dysrhythmia, revert them back to a stable rhythm. And then option 4, request a prescription for digoxin. Digoxin can actually cause dig can cause VTAC due to dig toxicity. So if our level of digoxin in our blood is not therapeutic, it can actually cause this dysrhythmia. So we would want to discontinue the digoxin. All right, you guys did great on that. Let's see who our big winners are. Congratulations to Maria V and Olivia J. We're so glad that you guys were on today. We will contact you with how to redeem your free 30-day UWorld subscription. Again, thank you guys so much for being here. It's been so fun being with y'all for Nurses Week. As always, come back, check us out at uworldnursing.com, and we hope you guys have a great night. See you later.